The reason why we wanted to do the study is a couple of folds. One is obesity itself is a major risk for cardiovascular disease, and we know that weight loss in those group of patients who have no cardiovascular disease is beneficial. But the problem with weight loss is patients tend to lose weight but also gain back. So in other words, they do this weight cycling. So we wanted to see if weight cycling in patients who already have heart disease is harmful. So our study published in the New England Journal of Medicine, what we found was when you compare patients who have a lot of weight fluctuations, we are talking about 8 to 10 pound weight fluctuation over a period of close to around 5 years. These patients had significant increase in cardiovascular events. There was a 64% increase in any coronary events, 117% increase in myocardial infarction or heart attacks, 136% increase in stroke, 188% increase in the risk of new onset diabetes. In other words, they're more likely to develop diabetes if you do not have diabetes at baseline. In fact, we also showed that these patients have a 124% increase in death when compared to patients who had minimal weight fluctuations, and these were patients who were weight fluctuated by 1 to 2 pounds. Patient who had the highest weight fluctuation also tended to develop diabetes, which is very important because diabetes, we just think that, okay, if you're obese, you're more likely to develop diabetes. We showed that here weight fluctuation by itself was independent predictor of developing diabetes. So in other words, if you have a massive weight fluctuation, you're more likely to develop diabetes regardless of your baseline body weight. This study is important because, in patients who have heart disease, lifestyle measures are recommended both by American Heart Association guidelines and other national and international guidelines. So we do tell patients, if you're obese, lose weight. And I think this study has implications because if this study is found to be true in other studies, I think we need to emphasize that it's not just losing weight, but maintaining weight is critically important, and that doing this weight cycling might be potentially harmful. So for I think other clinicians and researchers, it is very important to emphasize not just weight loss, but to maintain weight. So I think the next steps would be to do more studies, try to figure out a mechanism of why there is this increase in cardiovascular events with weight fluctuations.